Everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Divalproex. Its brand name is Epival. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So valproic acid is an anti-epileptic agent that dissociates in the gastrointestinal tract into valproate and valproic acid. It has an unknown mechanism of action. However, it's thought that its anti-epileptic effects is due to the increase in GABA levels in the brain. In terms of indications for use, it can be used for simple and complex seizures. It can be used for complex partial epileptic seizures. It can be used to treat mania in bipolar I disorder. And finally, it can also be used as prophylaxis in treating migraines. Now, before somebody was to use Divalproex or Epival, there are some precautions and warnings that they should be made aware of. So this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. You would want to avoid using this medication in patients who have a history of falls and fractures unless they're using the medication for mood disorders or for its anti-epileptic effects. It should also be noted that in this population, impaired psychomotor function and ataxia may occur. A good rule of thumb here is that in this population, we want to avoid using 3 or more active CNS agents, as it would increase their risk of falls, which may lead to fractures. It should be noted that if this medication is used with carbapenem antibiotics, this could result in a loss of seizure control. Hyperammonemia has been reported with or without encephalopathy, with the use of valproic acid and topiramate together. Using the two medications may exacerbate or unmask deficiencies in susceptible patients, so monitoring of ammonia levels may be required. Using high doses of Divalproex may put the patient at an increased risk of liver enzyme elevations as well as thrombocytopenia. Abrupt discontinuation of this medication in epileptic patients may put the patient at an increased risk of experiencing status epilepticus, and hypoxia may also be associated with this condition. Hyperammonemia has been reported and may be present regardless of the liver function of the patient. Monitoring would be recommended, and you may want to discontinue the medication if the ammonia levels are persistently elevated. Hypothermia has been reported with or without hyperammonemia, and the medication may have to be stopped if this condition does occur. Medication residue may be deposited in the stool of the patient using Divalproex, and this could also be associated with diarrhea. Discontinuation of the medication may be warranted. The elderly population may require a dose reduction and slower titration due to their increased risk of experiencing somnolence. Monitoring of excessive somnolence, decreased nutritional intake, as well as weight loss is recommended in this situation. Dose-related thrombocytopenia, as well as abnormal coagulation, has been reported. So baseline assessment and ongoing monitoring is recommended, especially in pregnancy or before a planned surgery. Potentially life-threatening drug reactions with eosinophilia and systemic symptoms have been reported, also known as DRESS, and the medication should be discontinued at the first sign of this. And finally, suicidal thoughts or ideation may appear in patients using Divalproex, so monitoring would again be recommended. Now, once somebody is made aware of the precautions and warnings and they start using Divalproex, they can expect to take their dose in tablet or capsule form. There's also an extended release formulation as well. If somebody is using the delayed or extended release capsules or tablets, and they're using it to treat absence, simple or complex seizures, they can typically start off with a dose of 15 milligrams per kilogram per day. The dose may be increased by 5 to 10 milligrams per kilogram per day in 1-week intervals. You want to increase the dose until seizures are under control or until adverse effects or side effects preclude further increases. The maximum daily dose would be 60 milligrams per kilogram per day, and doses greater than 250 milligrams should be given in divided doses for the extended release formulations as well as the sprinkle formulations. If somebody is using the delayed release formulation to treat mania in bipolar I disorder, they can use 750 milligrams given in divided doses initially. You would want to increase the dose as quickly as possible until clinical effect is realized. The maximum dose here, again, would be 60 milligrams per kilogram per day. When somebody is using the delayed release formulation to treat migraine in a prophylactic sense, they would use 250 milligrams given twice daily initially. Dose may be increased to a maximum of 1,000 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Divalproex or Epival, so I'll go over some of those here now. 9 to 23% of patients experience abdominal pain. 13 to 23% may experience diarrhea. Indigestion seems to happen between 8 and 11% of the time. 4 to 12% may experience a loss of appetite. Nausea comes in between 26 and 48%. And up to 27% of patients may experience vomiting. Up to 8% of patients may experience a backache. Up to 25% may experience dizziness. 11% of patients may experience a feeling of nervousness. Up to 31% of patients may experience a headache. Insomnia comes in at about 15%. Anywhere from 7 to 30% of patients may experience somnolence that we discussed. And for tremors, there's a very wide range. Anywhere from 1 to 57% of patients may experience one. Blurred vision, infectious diseases, and influenza are possibilities. Heart palpitations and tachycardia has been reported. Pancreatitis may occur at a rate between 1 and 5%. We mentioned during the video that hyperammonemia may occur. Some patients may experience liver failure, while others may experience drug reactions with eosinophilia and systemic symptoms, or DRESS. Finally, patients may experience hyperanemic encephalopathy. That's all we're going to talk about today with Divalproex or Epival. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.